Welcome back to the Academy Table. I'm Renee DeSilva, CEO of the Academy and your host, and I am incredibly excited to kick off our second season of the table. Throughout the year, we'll bring you a fresh slate of conversations with the industry's most innovative leaders and great thinkers. And this starts today with this episode featuring my good friend and colleague, Dan Mendelson. Last year, Dan joined JP Morgan Chase, where he now leads the firm's healthcare innovation team called Morgan Health. The venture's mission is to accelerate improvements to the employer-sponsored healthcare market. I especially enjoyed this conversation with Dan because employer-sponsored healthcare is often overlooked when we consider how to improve our nation's healthcare system. And that's despite it being the source of insurance for more than 150 million Americans, and also with an ever-increasing cost for employers and families. Here are a few of my takeaways from our conversation. First, I was intrigued by Morgan Health's collaborative approach to building their accountable care model and other solutions, be it capital investments or partnerships. Their intent is to be flexible with experiments in their own markets while keeping an eye towards scalable solutions for employers nationwide. Next, pay attention to how the team will evaluate success. Beyond returns on investment, they want employers to raise the expectations of what our healthcare system should deliver: advanced primary care and behavioral health, better population health outcomes, and improved health equity metrics across the board. Dan believes that only happens if employers can articulate these expectations and motivate insurers and providers accordingly. And lastly, I've known Dan for better than a decade, and I've always been impressed by his leadership approach. It was interesting to hear him reflect on building out this new team, which operates as a startup within a large and historic financial institution. Listen for his emphasis on values that has carried him from job to job, the top of that list being collaboration, integrity, and innovation. So with that, and for the first time this year, let's head to the table. Dan, so happy to connect with you this afternoon. Welcome to the Academy Table.
Great to be here with you.
So Dan, you are one of the people that I enjoy spending time with. So it's wonderful to connect with you. I was reflecting leading into this conversation that across my career, you have been pretty pivotal when I was thinking about making different career moves. A couple times I was trying to work with you directly. So it's really a delight for me to catch up. Maybe we can start by you framing for our audience a little bit about the early forces that shaped your career and interest in healthcare. You've done so much in the healthcare ecosystem. Let's just start with how you arrived.
So first, I'm equally thrilled to be here with you. And I've always loved our conversations, and I'm still hoping that at some point in our future that we actually get to work together, in the same organization.
I agree.
I'm a kind of the optimist's optimist. So I'll say that that's going to happen at some point. Gosh, early shaping. So I'd probably start that my dad is a cardiologist, and he worked at the Washington Hospital Center, which of course then became MedStar, for 52 years.
Wow.
And I'd say that, kind of growing up around our kitchen table, there were not very many subjects that he was more passionate about than cardiology. And so we, from the time that my brothers and I were very young, we all got our cardiology degrees sitting there in Bethesda, Maryland. And so, and not only did he talk about the practice of cardiology, which was very clinical at that point, he wasn't an interventionalist, but he really came home with a kind of a passion for his patients. And by virtue of it being an inner city hospital, he saw all sorts of patients with all sorts of needs and was just so caring for them. And just to kind of, we're all so privileged to work in the healthcare space because it is personal and it's passionate and we're working with people. And so that element to me is really, I would say, kind of a major motivator.
And then you sort of then started your career from a policy regulatory perspective and then began to weave in sort of business fundamentals as part of that. So just talk about, I think maybe one of your earlier roles was at OMB. Talk about that and then how that sort of meandered over time.
Yeah. So look, I've always had a passion for that intersection of public policy and business strategy, and kind of coming right out of college. I actually did my undergraduate work in music at Oberlin Conservatory. So there was kind of a little bit of an interlude there, so to speak, where I was playing professionally in Boston. But then what helped me to kind of refine health policy as a career option was I started working with a wonderful researcher at Tufts University named Bill Schwartz. And he was doing research on a lot of different areas related to health economics, workforce issues, the effects of managed care. It was really kind of like a master's class in health policy before I ended up going back and then doing a master's at the Kennedy School. And then I worked in consulting for many years before OMB. The OMB job was fantastic, because I'd always wanted to work in government. And for anyone who hasn't done it, I strongly recommend it because the government pays for so much of healthcare and regulates the rest of it. It's very important to understand how the government relates and kind of where those areas of focus lie and why government programs are the way they are. And while at OMB, I was able to be involved in getting health insurance to 10 million children through the establishment of the Children's Health Insurance Program. And that was all really great. But, it's kind of this relationship between business practice and government was always, I would say, kind of the thing that I was most interested in.
So then you founded Avalere Health, spent more than 20 years running that organization. And then at some point you had the opportunity to scan and figure out where you wanted to make your impact next. And so talk us through why Morgan Health. What about that opportunity, the problem that it's aiming to solve really spoke to you?
So I'd say that first, I had spent a lot of my career focusing on Medicare and Medicaid and kind of the issues attendant to that. And I think that there's relatively less focus on the 150 million Americans who get their health insurance through their employer. So, the policy agenda is so focused on the public programs, and it's understandable why, but I don't think that we solve the issues of the healthcare system without, an equal focus on the employer markets. And so these are markets that I haven't spent as much time in. And so that was, I would say, one motivator for me. I'd say a second is that given where I am in my career, the idea of deploying capital is really attractive to accelerate innovative practices because, I've encountered so many incredibly talented teams and people and feel like the way to accelerate progress is to work with teams that are really well functioning and to work very collaboratively. And so the idea of working collaboratively with other organizations and to be able to fund them to accelerate their innovation was also really super attractive to me. So it was really kind of it all kind of came together and maybe one other thing to mention is that JP Morgan Chase is an incredibly supportive environment, and the mission of our organization is very clear, and there's really been a kind of a warm embrace of these concepts by the bank.
And if you were to just articulate the core mission of Morgan Health for those that may be less familiar, how would you frame that?
Yeah, our mission is to drive innovation in employer-sponsored healthcare. So you can kind of, think about the way that we're framing it out. It's innovation, and then it's the employer-sponsored portion of the market that we are focused on. So we have been allocated $250 million from the firm's balance sheet to invest. And it's an initial allocation. And we are deploying that capital to really drive innovative practices. So whether it's accountable care or whether it is care navigation or whether it's the application of advanced analytics in places where we believe that we can improve the care, for our employees, as well as for the balance of the 150 million Americans who get their insurance. So our mission is focused not only internally, but also on the 150 million Americans who get their insurance through their employer.
That's really good. I want to unpack that a bit. So 150 million folks covered through their employer. We all note, just personally, those of us who are employed or in the business of employing people, that premium, I think it's 21,000 for an average family right now. That's grown by 55% since 2010. So a pretty meaty problem to solve. There have been a number of approaches in trying to really get at how do you more effectively manage the benefit spend from an employee perspective. What are you bottling from other experiments that we've seen industry-wide? And then maybe how do you think about Morgan Health being really well positioned as a result of some of the lessons learned?
So we've thought a lot strategically about where to go first. And this concept of accountable care is really one that we believe has a lot of potential, where you have clinically led teams that are responsible for quality and cost. Philosophically, we believe really strongly that the quality element, and in particular thinking about population health, reducing cholesterol, helping diabetic patients manage their A1Cs, making sure that employees have routine cancer screenings. If you think about the kinds of population health metrics that have become prevalent in Medicare and Medicaid are really not being used in the employer market. So we want to bring that mentality of improving population health into the employer markets. And that's really the organizing principle for a lot of what we're doing right now.
And so you talked about this a moment ago, but I think it's interesting to go back to it a bit. The strategy driving improvements through a capital allocation, $250 million initially, with maybe more to come. You then talked a little bit around the JP Morgan health benefits, or the reach of your employee base as a good lab, if you will, to drive broad accountable care and pop health strategies. And then maybe the third leg, as I heard you talk a little bit about it, is around promoting health equity. Let's double click on the way that you think about the allocation. I think you made your first initial investment in Bearer Whole Health. How are the decisions made around where you put those dollars to work, and what in particular about that particular investment made the team excited?
So first, we have a whole set of investment criteria, and it's a process. We have an investment committee. It looks a lot like a private equity firm in that aspect. So we are a strategic investor, meaning that we will not look at a company unless it is directly related to the mission, which we talked about before, which is driving innovation in employer-sponsored healthcare. And then further to that, we've refined our areas of focus. Accountable care, care navigation, analytics is really being, the first areas that we're going to focus in. I'd say there are certainly others. So, for example, we're delving in very deeply into behavioral health right now. We as a country face a crisis around mental health, given where we are and given the pandemic and given, kind of what we see in the case rates. And so that's a place where we're thinking a lot and doing a lot of foundational work, and hope to also be investing. There are, other areas that I'm sure that we will get into over time, but we've really focused on, what is going to promote the mission, and in particular, kind of this concept of accountable care. And I'll say also, we have a balanced scorecard that we are using to assess our progress. So we have a whole set of metrics ourselves that we're being held accountable for, that we've developed, and some of them are related to the health of our employees, like the A1Cs and the cholesterol levels that I mentioned before. Some of them relate to the availability of accountable care models nationally. So that pertains back to the 150 million Americans who have their insurance through their employer. And then, of course, we're looking to achieve a strong market return on the investments that we make. So it's really all three of those areas that we're focused on simultaneously.
So given that, it's fascinating, given that maybe way that you're approaching it, how has that then driven the ways in which you've shaped the core team? Because many of these functions, you would not necessarily see under one umbrella. So it's really interesting, curious how that's impacted recruiting and the team that you've assembled.
Yeah, we have great people. And I mean, I'm smiling because that has really been one of the big pleasures of this position so far. So we because we're very mission oriented, we have attracted mission oriented, people who want to make a difference. And so, it's not only that they have a certain skill set, it's also that they're passionate about driving change, and they're ready to take on the employer sector. It's like,
Yeah.
it's not for the faint of heart, by the way, which we can talk about, like why it's so hard. It is hard, but so I'd say that kind of the commonalities are passion and an interest in taking on big problems. So in the area of healthcare innovation, we have Dawn Alley, who joined us out of CMS, where she was Chief Strategy Officer of CMMI. We have Rivka Friedman, phenomenal person who ran the state demos program at CMMI before she joined us. We have also, a fair amount of talent from the health insurance industry. We have some folks off the Hill. It's kind of a diverse mix of talent there. And then the second skill set is transactional, because ultimately we're placing capital. So we have there Dan Hartman, who joined us. He actually was a wonderful legacy item from Haven, but he came with experience from Goldman Sachs and a number of other kind of financial institutions, and then supplemented him with another senior investor, Jeff Reese, who came out of HealthBox and a number of other, private equity investing organizations. And then on the health equity side, we also felt, a real passion for bringing in expertise. And we were joined by Nellie Ganesan, who came out of Avalere, who has been doing health equity for a decade and is leading a lot of our efforts there. So, I could go on and on about the team. I'm leaving wonderful people out, but it's a great group. We've got about 20 staff so far. We have another 10 headcount allocated. And I think where we are right now is that given the talent that we have, we'll probably take a little bit of a breather and figure out what we need going forward before we kind of reinvigorate the hiring process.
It sounds like a really great cross section of talent, which would make a fun place to work. Maybe expanding on that a bit. Your approach when I'm listening to you feels very much, partnering, finding things that are working and working to maybe accelerate those further. I know that you've already assembled some existing partnerships, one with Kaiser around health disparities. So just talk about how you see the role of partnership and maybe bring to life a little bit more about the Kaiser work that you have underway.
Yeah, well, maybe before I go into Kaiser, I'll take a step back on Vera, because you asked about Vera before, but that's our first major entry in the market, if you will. And then I'm equally excited about the Kaiser work, but Vera was first, so I want to give them top billing, if that's okay.
Yeah, please.
So one of the things I mentioned before that we have 285,000 employees and dependents. And one of the interesting things about JP Morgan Chase is that about half of our employees and dependents are concentrated in 7 geographies. So we have large concentrations of employees in Columbus, Ohio, in Wilmington, Delaware, and Plano, Texas. And there are, a number of other geographies where we are a relatively large fish in a relatively smaller pond. And so it's really those geographies that we are going to be focused on, because I think that philosophically, one of the things that we feel strongly about is that we want a nationally consistent benefit, and we also want to make sure that we are engaging the delivery system, which is local by definition, and so you look at each of these different markets, and this from your membership, that they're all really different. And New York City is different from Boston, is different from Columbus. And so we're taking a very geographic specific approach to making these accountable care models available. And so Columbus is a great site for us because it's a major call center operation for the bank. And it's really a place where there are some outstanding providers. And so there's a primary care practice, Central Ohio Primary Care, which is loved by our employees. I think about half of our employees who have a committed primary care relationship have it already through COPC, which means that they're a great partner for us kind of coming out of the box. And the Vera partnership is with COPC and Vera Whole Health, and wonderful private equity firm involved in that one, CD&R, and in particular, Ravi Sachdev, who is our partner in that venture. And, we went in because we kind of pulled this partnership together with Ravi because we saw the capabilities of Vera, and then we also saw their passion for delivering full risk product to employer markets. And so that's why it was the first one. And we're working with them. We're developing out this product, and we will launch it, probably it's a little hard to say exactly when it's going to launch because we want to get it right as opposed to getting it fast. But it'll launch certainly by the beginning of next year. And we will be offering, this accountable care model with a really wonderful kind of primary care front end to our employees. And we're really very excited about that. So that's the first project out of the box.
That's great. And then the idea would be you sort of build a test case in Ohio, figure out what works there, and then adapt it to the other markets where there's some density in terms of employee population.
Well, first, everything that we do is intended to be scalable to the market. So what we don't want to do is enter into like a center of excellence partnership with a local provider that could not be used elsewhere. So, the Vera model is already being deployed in other markets, but the focus for us with Vera is in Columbus. I'll say that we are not wedded to only using Vera in our pursuit of accountable care. We will undoubtedly be working with other organizations as well as we move forward. So the idea is not to necessarily use. Think of us really as an organization that is interested in innovation and testing and kind of moving the ball forward to provide really outstanding care, not only to our employees, but also nationally. And, that's does involve a fair amount of experimentation, but we will certainly be working with other organizations as well as Vera.
That makes sense. All right. So now talk me through maybe the complexion of the Kaiser partnership.
Kaiser partnership is great. I mean, there's an organization that is incredibly data rich. So by virtue of their operating model, they have really excellent data. And, when we started initially our focus on health equity, we really wanted it to be a data-driven approach that then involved very clear performance guarantees. I mean, we believe fundamentally that our providers, as well as the organizations that are responsible for the care of our employees, really should be our partner in the elimination of any disparities that we see. So you have to start with what are the disparities that we are looking to eliminate, and then put in place incentive programs. And the Kaiser team completely understood that from the get-go. And they're also in a position where they can actually do something about it because they have the data. They can analyze the data. They can, they have enough of the relationships and the leverage to engage with their providers so that they can communicate like what's important and what's interesting and what's really where the requirements are. So we're in a process with them right now where we're putting the fine points and the details around a set of performance guarantees that are around closing any gaps that we identify that exist in that population. So we're really very excited about that. And look, it's also when we announced this partnership, we were really gratified, and our contacts at Kaiser came back and said that a number of other employers called them and said, "Hey, we'd like in on this," and we're thrilled about that because we're not about doing proprietary things. We're about driving change. And so if there are other employers who want to work with us on that, all the better. And it's also our hope that our carriers will be able to do the same thing. It's it's in the fee-for-service world, it's not as data rich. At least you don't have the outcomes information that the Kaiser team will, but nonetheless, I think it's viable. And as an approach, we hope that everyone who's doing business with us is going to be, as excited as we are about taking on these performance guarantees and helping to eliminate any disparities that exist in our populations.
Yeah, what's so interesting as I'm listening to you talk is the health equity conversation is typically not as attached to employer-based coverage. It
Hmm.
just it
Right.
tends to not come up. So it will be what I'm looking forward to as you all track this. And I know that you've got some of your roots in the analytics and space too. Would be what do you all
Hmm.
learn from that can be shared industry wide in terms of Morgan Health as a catalyzer of models like that getting adopted that maybe you're not directly involved in.
Yeah. Yeah. This is to me kind of the exciting part about this, which is that, employers really do have the ability, and I would say even the imperative, to raise their expectations of what is being delivered in the healthcare system. And we need, we need more population health. We need more preventive care. We need more attention to outcomes, and we need a delivery system that is ready to address these disparities that we see. And it's not acceptable to just talk about it. We have to be putting in place mechanisms through which these issues can be addressed. And it's really interesting. The idea, look, in government, and Chiquita Brooks for sure, who's wonderful and I think doing a great job over a CMS administrator. And she's a person, by the way, that I worked with her at OMB. She was on my staff at OMB, and then she came over and she was with us at Avalere for about 5-6 years, and we had a great relationship there. And now she's at CMS. So I actually got two separate
Interactions.
times to work
Yes.
closely with her, but and now, we're there's a lot of information going back and forth between us and CMS right now because we're passionate about the same things. And look, she has mechanisms for both Medicare and Medicaid, and I think she will be using those payment system levers as well, but she doesn't have levers over the employer sector. We do. And employers do have the ability to articulate this expectation and to motivate the insurers as well as providers to adopt these practices. So this is a time where employers have to step up and articulate these expectations and put in place these mechanisms. So that's what we're trying to motivate here.
And I guess if you were to, if we're having this conversation maybe 5 years from now, I know you mentioned the balanced scorecard in terms of many ways in which you evaluate success, but is there a metric that the team is rallying around? Is there sort of a North Star that you think would be the best indicator that all of these various experiments is really moving the needle? What are you looking to in terms of making that?
We have, specific clinical population health improvement metrics. We want to, to see improvement in all of those areas. And we have, specific quantitative improvement that we're looking to see. With respect to health equity, we're also looking at those standard measures to make sure that we address, any inequities that we have in our population. And they're different from the government, kind of Medicaid is different from Medicare, is different from commercial. And so, thank God we do not have issues with low birth weight babies and maternal death. And, you hear Chiquita talking about that a lot because that's the most important target in Medicaid. And, we don't have that issue. And so we're going to be focused elsewhere in terms of helping to get our population metrics under control. So we kind of go from the data and progress from there.
Yeah. And then I guess the other piece that would be interesting too, as you learn what either holds the line on benefits increase or benefit spend increase for JP Morgan, or can take a bite out of it, just the extent to which we could rapid cycle things that are working relative to that model more broadly. Yeah. I think there's a big appetite.
Interestingly, this is, so just to be super clear, this is not a cost-cutting exercise for JP Morgan Chase. And, I had this great meeting with our CFO where, before I kind of walked into his office and before I started the meeting, he was like, do not tell me you are going to save me money. Because
that's like, nice.
Well, yeah, well, look, it's at this point, like anybody in healthcare who walks into the CFO's office and says, I'm going to save you money, probably, is not going to be in that job for very long. It's very hard to measure it. It's really hard to ultimately deliver on that. And I think that, look, it's certainly in my mind, but the more important financial metric that we are thinking about is patient affordability, because, the benefit exists for employee retention. And the benefit exists to make people's lives easier and to improve their health. And it's the affordability issue that employees in America are struggling with. I mean, what's happening, of course, as we all know, is that you gave the kind of the $20,000 number, which is really from the perspective of both the employee and the employer. But every year, healthcare eats more and more out of Americans' paychecks, so much so that for moderate and lower income individuals, it's consuming any wage gain. And so, I think all of us really have a strong imperative to deal with the affordability aspect of healthcare, not just the cost.
I think that's really well said. All right. I want to switch gears a bit and talk about you as a leader. And, I guess maybe my question for you might be, you have led in such diverse environments, and you're now sitting, and you've called it, well, it is a startup inside a historic and such a well-respected institution. I wonder how you're just approaching transferring lessons, maybe what you're taking with you from previous leadership roles, maybe what you're leaving behind. Talk to me a little bit about that.
I would say that for starters, there are certain values that are very important to me as a human being, and that those are the values that I carry from job to job. And so it doesn't really matter where I am. And they involve, collaboration is certainly one, integrity is another, innovation is another. I mean, kind of like parentheses, you can go onto the Avalere Health website and look at the values, and that's kind of what, I kind of.
But you said 20 years ago?
Yeah, exactly. So, those are things you carry from place to place. And I am a very relationship-oriented and relationship-driven manager. I love people. I love being with people. I love engaging with them. I love seeing people grow. I love seeing them succeed. And so, that is also something that motivates me. And I always will do everything in my power to structure teams so that that happens and that succeeds. And I always want to be in environments where I can do that, and where the organization is supportive of those goals. I'd say what modulates from place to place, is that you have to be sensitive to the context and the environment in which you are working. And so, OMB, it's an incredibly fast-paced, fast-moving, engaged organization, but the structure of OMB is not going to change. It's like you don't go in there thinking, oh, I'm going to reorganize the place. Otherwise, it's a very difficult thing for someone in the health pad job to do. But really, kind of the what you can accomplish in a place like that is kind of understanding the history, understanding the structure. Where do you want to prioritize and focus your energies? And so, this prioritization, the choice that a leader gets as to where to focus the organization, I think that is the key. It's really when you start with the values, and then the next thing is what are you going to prioritize? Because you don't get to do that many things. When you're the CEO and you're kind of shaping an organization, you have to be super clear about what you want. And there are a lot of people in the organization who have to really understand the vision. So it's kind of that prioritization that I think is important. Then there is the shaping of the organization. You had kind of said you're a startup within a very well-established, well-respected brand. And that's exactly, kind of the way that we're organized now. And so we have to respect both of those imperatives, so the startup imperative, the energy, the momentum, the kind of the drive to succeed rapidly, and then the established brand part. A great example of that is, JP Morgan Chase is an organization that's very attuned to cybersecurity. And so everything we do has to meet a very high bar, in the cyber area. And that makes complete sense, but that will slow us down, for certain things. And so there has to be kind of a respect for both the startup imperative as well as the protection of the established brand.
I love that. I was just going to offer an observation that I had about your style that just in my interactions with you, which gets back to the values, is that you also always, to me, seem grounded And I know faith is a big part of your life. And I've seen how you've made it in the frenetic pace that a CEO job can often entail. I've just noted in interactions with you that you have found ways to stay really true to what matters beyond the day to day. And that, that I've, in our interactions, I've sort of taken that away and figured out, how do I apply that to my own time spend? And so I would just offer that to you as an observation.
That's so, first of all, thank you for that. I think it's always a balance. And like, hearing you say that kind of makes me think, have I done enough, to do that, but look, I'll say that I do really deeply love my family and have always tried to make sure that there's a balance between the home life and the professional life. And I think, frankly, that makes for a better professional. And so I've always really been encouraging of my staff to maintain that balance. I'll say that, it's never perfect. And in transactional work, oh my God, I mean,
Yes,
there are times when it just doesn't work and you just have to say, hey, I'm going underground for the next couple of days. And I think, what's on the other side of that, and I'm thinking about like some of our transactional folks who, when we're in the midst of closing a transaction, just really have to go heads down. So part of it is, the commitment of the individual, but part of it also is how flexible and supportive their family is. And I have really been blessed with a very supportive family and kind of tolerance of some of the craziness of the hours that I've had to work at times. So like it's a balance, but I appreciate what you said though, it does cause some introspection whenever you're thinking about that.
Oh, absolutely. I'm in the thick of it too. I still have middle and high school aged kids, and it almost feels like they need more of you now than they did when they were toddlers. So I definitely get that. All right. Last question before we wrap. So the intention of this podcast, the Academy Table, was really around creating space for conversation and just getting back to joy when we're able to spend time together in person. And so I wonder, if you could invite any two people to your table for a conversation, who would they be and why?
Oh, like any two people.
No bounds.
It's funny. Like, I'm sorry?
I was going to say no bounds on that. No boundaries.
No bounds. Any two people. I would say that I spend a lot of my time just thinking about these healthcare imperatives and how to fix the problems that we all face. And when I'm thinking about these issues, there's kind of a lot of managers, I think, are, you think about it conceptually and you think, well, swing for the fences, the titans of the IT companies, or maybe, the people who are, running really large corporations. But I don't think that's where the change is going to come from. And so if the goal of a conversation is to kind of move healthcare forward, which is kind of my mindset at this point in my life, the conversations that I want to have are with Liz Fowler and Chiquita and, people who are managing, the benefits, are kind of committed to change from really outstanding Fortune 100 companies. And these are the kinds of conversations that I want to have right now, because it's like the practicality of it is really important, So I would say, I'll probably have those conversations with people who are managing healthcare institutions and engaging in that way. And those are the conversations that I'd love to have when things get back to normal. So I'll take a pass on the titans of industry and go for kind of my peers across government and industry.
That's fantastic. Well, I should have asked this question. So maybe this is now my final question. What instrument did you play? You mentioned that you performed. What was your instrument?
I play violin and viola, and I still do. And in fact, I played a little known fact. I played a concert at a nursing home called Revit's House in December with a wonderful band called Locks and Vodka. And actually, my brother, who plays the bass, I have two brothers, and we all play something, but my brother plays the bass, and he's an excellent klezmer bass player. So he and I played together at that concert in December for a very appreciative audience of octogenarians.
That's amazing. All right. That's a perfect place to land, Dan. Thank you so much for your time today. It was good to catch up.
My pleasure. Thanks for the conversation.
Thanks again for joining me at The Table. The Table is a podcast produced by the Health Management Academy. Make sure you catch future episodes by visiting our website, theacademytable.com, or by subscribing on the podcast platform of your choice. And if you have suggestions for topics or guests, I'd love to hear from you. Please drop me a note at renee@hmacademy.com. I look forward to talking with you soon.